Reshaping the breast by adding or removing volume involves making a few decisions that can be confusing. I want to take the next few minutes to walk through these decisions with you so that you can have some time to think about it before we sit down in person. While some people still have saline implants placed, it is very uncommon at this point. Silicone implants feel more like breast tissue and don't have the risk of rapid deflation after rupture. All of our surgeons are comfortable doing over or under the muscle techniques, silicone or saline. It depends on your aesthetic goals. There are two places for the implant on your chest wall: over the muscle or subfascial, or under the muscle. When we go over the muscle, you can achieve a more augmented look, but you may have some rippling that's noticeable if you have thinner skin or thinner breast tissue. Going under the muscle will help shield some of that rippling, but it does mean you will have some animation deformity with certain activities. Two of the long-term risks with breast implants are capsular contracture and rupture. They are uncommon, somewhere between 5 and 8% over many years after surgery, depending on the implant manufacturer. Once the implant is placed, the body puts a thin wall of scar tissue around it to prevent the body from interacting with the implant. Unless something triggers the scar tissue to get thicker, the body usually just leaves it alone at this point. However, in the case of an infection or problems with bleeding, there can be increased scar tissue around it and the implant will become more projected and firmer over time. Rupture is also uncommon. These shells around the breast implants are very durable. We ran this one over with a car. As you can see, it's completely intact. Typically what happens is that the breast implant will get a small fold in it and that shell will rub on itself for 10 years. That can cause a crack, which lets in fluid, which makes the crack bigger, more fluid, until eventually the shell has a rupture along most of its length. This is essentially the opposite of capsular contracture, and you will see that the implant becomes less projected and will start changing shape. Because of these two risks, the FDA recommends getting some form of imaging starting 5 years after surgery and then every 2 to 3 years after that for ongoing screening. Of course, if you're ever having issues, please let us know and we can investigate sooner.